Hello Pharma aspirants, welcome to GDC English classes and also welcome to the Margdarshan Series. So this is a series for a demo classes, free demo classes for the students who are looking for Gpat 2025 coaching, that is GDC Prime, especially for the South India Pharma students from the Andhra Pradesh, Telangana, Kerala, Karnataka as well as Tamil Nadu. Okay, so in this session, we will discuss about the pharmacodynamic topic, adverse drug effects, and along with that, some important basic definitions from the general pharmacology. So, as you know already, GDC started classes in English language, especially for the South India pharmacy students regarding GPAT, NIPER, Drug Inspector, Pharmacist, and other pharma competitive exams. And myself, Ashok Kumar, I completed my MS from NIPER Raebareli in 2015, and till then I am working as a assistant professor in the pharmacology department, and I am also GDC South coordinator. So I am the coordinator of GDC South India. So you can contact me on 799-531-8103. Okay. So adverse drug effects. So what is adverse drug effect or adverse effect? It is defined as undesirable, mean unwanted effect due to drug administration. So it is undesirable, nothing but unwanted, and the effect is mainly because of administration of drug. The adverse effect of a drug, it may be alphabetically like augmented pharmacological effect, bizarre effect, chronic effect, delayed effect. So these are the four different types adverse effect we can easily categorize it. Okay. So here simply augmented means going forward, increasing. Bizarre means so what is the meaning of bizarre? Bizarre means unexpected, the strange thing, the crazy like that. And chronic effect. Chronic means on long term. Chronic means generally these are observed at high dose. And delayed effect. So generally these side effects are take some time to appear. Delayed, take some long time to appear. Let's see in detail all these four types of adverse drug effect. First one is augmented. So regarding the augmented, here dose dependent, it is dose dependent. If the dose increases, this reaction also increases. So that is side effect, toxic effect, intolerance, idiosyncrasy. So these augmented are again side effect, toxic effect, intolerance, idiosyncrasy. So regarding the side effect, the side effects are unwanted but often unavoidable pharmacodynamic effects occur at therapeutic dose. So generally these are also unwanted. These are also like unwanted, unavoidable, because side effects are nothing but side effect. These are the effects observed along with the drug action. For example, morphine acts on the cns and produces analgesia, pain relief throughout the body. But the same morphine by acting on the GIT produces constipation by decreasing the gastric peristaltic movements. Yes, this side effect is unavoidable, but it should be unwanted. So side effects are nothing but these are observed because of drug action. So generally they are not serious, can be predicted from the pharmacological profile of a drug. Yes, we can predict because yes, constipation is a predictable because of morphine action. Predictable from the pharmacological profile of drug and known to occur in a given percentage of drug recipients. Okay, so occurs in a given percentage of the drug recipient. For example, atropine generally used during the surgical procedure to maintain the heart rhythm, but the same atropine may block muscarinic receptors in the salivary glands and may decrease the salivary secretions. So atropine on heart is general action, but because of its action, it may also shows effect on the salivary gland and decrease the salivary secretion, that is side effect. So side effect is simply occurs because of drug action, occurs along with drug action. Next, toxic effect. These are the result of excess pharmacological action of the drug due to overdoses or prolonged usage. Toxic effect. So generally the toxic effects are because of excess pharmacological action, the overactivity of drug, that may be because of overdose or using of same drug for prolonged time, long time. So overdoses may be absolute, accidental, homicidal, suicidal, or relative, that is, for example, usual dose of gentamicin, a amino glycoside, comes under the protein synthesis inhibitor category in bacteria. So usual dose of gentamicin in presence of renal failure. So don't use gentamicin in renal failure, because generally gentamicin is a under category aminoglycoside. It causes nephrotoxicity. And some of the drugs like diuretics like furosemide causes ototoxicity, damage to the ear. Ototoxin nothing damage to the ear. Next further continuation, intolerance. So what is intolerance here? It is appearance of characteristic toxic effects of a drug in an individual at therapeutic dose. Generally particular therapeutic dose is fixed, for example paracetamol 500 mg. So in all human beings, generally in all human beings, this 500 mg is suitable. Okay, so simply here appearance of characteristic toxic effect of drug in an individual dose at therapeutic dose. So for example, we know that the initial dose, even in the pharmacology, regarding the laboratory. So regarding pharmacology 1, you performed experiments to know point 1, point 2, like dose response curve, point 1, point 2, point 4, point 8, 1.6, like that you perform experiment dose response curve. So at initial doses the response will be starts. When dose increasing, the response will be increases. Still if you are increasing the dose, what will happen? The response will be struck. That is because of decreasing the receptors or damage to the tissue what you are using in the organ path. But here I am talking about at therapeutic dose also, the patient showing not beneficial response, he is showing toxic effect. So that is intolerance, he is not responding to that dose. Okay, next, idiosyncrasy, genetically determined idiosyncratic reaction. So generally there is a adverse effect, they are known as idiosyncratic reaction, because the specific reason is no, there is no specific reason. And it is genetically determined abnormal reactivity to a chemical. The drug interact with some unique feature of individual not found in majority of subjects, produces uncharacteristic reaction. So these idiosyncratic reactions not observed in all people, but observed in very few cases. That is, maybe they having some unique characteristics in their body. Okay, idiosyncratic reaction. For example, uh, one of the idiosyncratic reaction like drugs like morphine deuteroborine, in some patients, in some subjects, they increase the histamine release. That is type of idiosyncratic reaction. And excess histamine release may leads to allergic reactions. Okay, sorry. Next, after augmented, next is the bizarre, unexpected. We unable to predict also. In that bizarre, first we will see drug allergy. So what is drug allergy? Abnormal response mediated by the immune system to a drug or any foreign antigen. If any foreign antigen like bacteria, virus enter into the body, or any drug enter into the body, definitely our immune system will react, produce abnormal response in the form of allergic reaction. So this drug allergy, nothing but the allergic reactions are 4 types based on trick A, B, C, D, like type 1, type 2, type 3, type 4. Okay. So here type 1, type 2, type 3 allergic reactions known as humoral immunity. They comes under the humoral immunity, that is antibodies are involved. Antibodies are involved. And next, Type 1 hypersensitive reactions are also known as anaphylactic reaction. So generally these reactions are observed when any drug enter into the body. When any foreign antibody enter into the body, they react to the drug as well as antigen and produces mediators like histamine, prostaglandins. If this mediators production become excess, that may lead to severe allergic shock or anaphylactic shock. So type 1 hypersensitive reactions known as anaphylactic reactions are severe allergic reaction. Severe allergic shock, anaphylactic shock. The antibody involved is IgE. And type 2 hypersensitive reactions known as blood cytolytic reaction. So in this type of allergic reaction, our blood cells will be affected. They become breakdown. And in case of here, there is involvement of IgD as well as IgM. Okay. And next type 3 hypersensitive reactions. Here there is a involvement of complex that is between antigen antibody reaction, and that may destruct our own body, that may damage our own body. So the complex antigen antibody reactions, and also known as Arthur's reaction, involved by IgG antibody. Next, cell mediated or type 4 hypersensitive reactions, also known as delayed hypersensitive reactions, are cell mediated. That is nothing but these are cell mediated involvement of T cells, nothing but T lymphocytes, also known as CD4 cells, cluster differentiation type 4 cells. And the cell mediated through the production of the T lymphocytes, a type of WBC. Okay. So here the involvement is type 1 hypersensitive reaction IgE, type 2 IgG as well as IgM, and type 3 only IgG. Okay, and type 4 under the influence of T cells. And here some of the list of drugs which may cause allergic reactions. But the allergic reactions are not in all patients, and especially few are the patients who are become sensitive to particular drugs. Like penicillins causes 𝘎𝙎𝙎𝙎 reaction, and aspirin may cause a type of race syndrome which may cause asthma also. Cephalosporins also same like penicillin causes 𝘎𝙎𝙎𝙎 reaction, and indomethacin a NSAID. Sulfonamide causes Steven-Johnson syndrome. Carbamazepine causes allergic reaction which is an antiepileptic drug. Tetracyclines may develop Fanconi syndrome, and allopurinol, a drug for gout. Quinolones, fluoroquinolones, drugs as antibacterials. AC inhibitors, antihypertensives. Metronidazole, a antiamoebic. Methyl-dopa, a antihypertensive, acts on alpha-2 receptor in CNS. 𝘎𝙀𝘋𝐼𝑟, antiviral drug. And hydrolazine, a vasodilator, chemically thiazine derivative. So these are the list of the drugs may generally causes some allergic reaction, and generally if they are causing allergic reactions means they interfere with the body immune system. Okay, so we completed augmented as well as bizarre. Next is the chronic effect. So what is chronic effect? Let's see. Means duration, chronic, long term. Duration dependent adverse effect on prolonged treatment. So the treatment with the same drug for long time. Delayed effect, adverse effect long time for after stopping the drug. So the adverse effect may be continuous, may be still in the body after stopping the drug also. These are known as delayed. For example, local anesthetic lidocaine cream when applied on the skin, it develops allergic reaction, but the allergic reactions may appear after drug administration into the body, after 3 to 4 days of drug administration into the body. So these are delayed, appear lately, not immediately. Mostly type 1, type 2, type 3 appear immediately. Type 4 hypersensitive or allergic reactions are appear delayed, means they appear late, they take time to produce action, nothing but adverse drug reaction. So a chronic condition develops and worsen over an extended period of time as an atherosclerosis, like atherosclerosis. Next, in an acute condition, symptoms appear and change or worsen rapidly as in heart attack. That is simply chronic as well as acute. Chronic as well as acute differentiation. So next, photosensitivity. So photosensitivity also comes under adverse drug effects, and these are like idiosyncratic reaction. Mostly the reason is unknown. So photosensitive reaction. Photosensitive reaction. Photosensitivity two type: phototoxic, photoallergic. What is phototoxic reaction? Accumulation of drug or its metabolite in skin. Accumulation of drug or its metabolite in skin. So the drug in the skin may absorb sunlight when you exposed. For example, I took some tetracyclines and I went outside. So definitely I will get some allergic reactions when exposed to sunlight. So accumulation of drug or its metabolite in skin, it absorbs light and undergoes a photochemical reaction. So here it is the phototoxicity. Here it is the phototoxicity. So that leads to local tissue damage due to sunburn, and that sunburn may causes erythema, redness of skin, edema, swelling, accumulation of fluids, vascular eruption. The blood vessels may be damaged, the blood vessels may be opened, and blistering, which have fast onset, shorter duration after exposure end. So blistering means the redness will be spreading like this. Means the redness will be spreading on the skin. So you can see here, this is the total phototoxicity. And this type of phototoxic reactions last for short time, and after, if you again come back to closed area, means not exposed to sunlight, these are disappear. So when you enter into sunlight, these will appear. Again you come into inside, you are not exposed to sunlight, these are disappear. So these are the short reactions, means these are last for short time. Example like phototoxic reaction occur with the tetracycline, especially one of the example of tetracycline, demiclocycline, and also one of the anti-malarial drug, chloroquine. And especially this phototoxic reaction observed at wavelength of 290 to 320 nanometer. Next, photoallergic reactions. Next is the photoallergic reaction. So photoallergic reaction, drug or its metabolite induces cell mediated immune reaction, means increase the T cells. T cells promote our immune system function, and when exposed to light of longer wavelength, 320 to 400 nanometer. So here the photoallergic reaction nothing but the drug or metabolite increases cell mediated immunity when exposed to light with wavelength of 320 to 400 nanometer, and produces a popular or eczematous contact dermatitis like a picture may persist long after exposure. So phototoxic reaction, they persist for short time. Once you coming back to close room, nothing but without any sun exposing area, the reactions will be stopped. But photoallergic reactions take time to appear on the skin, but once they appear on the skin, they take long time for disappear. They take long time for recovery. Okay, yes. Now, the total South India Pharma students are waiting for this announcement, that is GPAT 25 to 26. The GDC Prime long term coaching for the GPAT is starting from the July 15. For that purpose only, this Margdarshan series is freely available to you. So, daily in at 9 p.m. from 22 June to from July 7, daily any one of the subject from Gpat syllabus will upload in our YouTube channel, that is GDC English classes. So subscribe to GDC English classes for daily updates. And as you know, the features of the GDC long term coaching for South India pharmacy students, that is GDC Prime 25 as well as 26. So if you want, you can go for 1 year coaching or you can go for the 2 years coaching. The features like 500 plus daily live classes, 23 plus hard copy book specially designed for the GPAT as well as NIPER expertise persons under the GDC, and 500 plus pre-recorded video lectures, 500 plus online test series, 500 plus daily practice test, and 36 plus previous year question papers to understand how since last 30 years the question paper is given, and on topics, on which topics they are focusing, and in what way they are giving the questions. So for this information, you can contact the numbers here, and not only that, you can also contact me on my personal number 799. So you know already myself, yes, myself Ashok Kumar, and I completed my MS from 𝘂𝙂𝙎𝙬𝙬. I passed out from 2015. Okay, so you can contact me on this number 799-531-8103. Okay, next. So continuing further, drug dependence. So what is drug dependence? Also known as drug addiction. State where a person become dependent on drug despite knowing the harmful effect of the drug. So simply, I like the gulab jam. If I eat more gulab jam, definitely I will get some throat problems, or I will get cold like that. So here, like here also, the person who addicted for the drug, they habituated to drug. They depend on the drug despite knowing the harmful effect of the drug. So the drug dependence, so the drugs like alcohol, nicotine, morphine, cocaine, heroin. So these are like some drugs may cause addiction. Why the people are habituating addiction to these drugs? Because of like these drugs, they enter into the CNS and they stimulate the addiction center, that is nucleus accumbens. So in the CNS, there is one of the small area nucleus accumbens known as addiction center. So all these drugs stimulate this addiction center and increase the dopamine action in the brain. When dopamine action in the brain, nothing but CNS increased, central nervous system, it leads to euphoria. So dopamine is a pleasurable hormone. It produces euphoria. What is euphoria? Highly excitable state. Highly excitable state. In this state, the person does not feel any tension, any fear, any pain. So for this pleasantness purpose, he addicted to drug. But when he continuously taking the drug accumulated in the body, especially in the CNS, and it may lead to the other suicidal thoughts also. So the dependency is psychological as well as physical. Psychological as well as, okay. So the dependency is generally two types. The dependency is generally two types: physical as well as psych. So the dependency is generally two types: physical as well as psychological dependence. Physical as well as psychological dependence. Okay. So physical dependence is physical illness of drug is withdrawn. The illness to the physical system is because of if drug is withdrawn suddenly, and psychological, emotional distress if the drug is withdrawn suddenly. So drug withdrawal, for example, if I am habituated to alcohol, if I want to withdraw, if I do not take alcohol suddenly, for example, till today I took alcohol, if suddenly tomorrow I won't take alcohol, my body will develop some withdrawal symptoms. The withdrawal symptoms like it may like sweating, it may like chills, it may be irritability, it may be anxiety, it may be nausing like vomiting sensations. Okay, so that is the symptoms of tramadol withdrawal. What is tramadol? Tramadol is a non-selective beta blocker for treatment of hypertension as well as glaucoma also. And also there is a chance of some withdrawal symptoms may be also because of anger, may develop fear, may become self-pity, means we will become embrace on ourselves, frustration, and feeling like jealousy, feeling like anxiety, feeling like reinforcement, means taking of same drug repeatedly, taking of the same drug repeatedly. And next, drug addiction. The simple definition of a drug addiction: a person is said to have developed drug addiction when he or she believe that optimal state of well-being, that is euphoria, the euphoria is achieved only through action of drug. So when the person habituated to drug, addicted to drug, he feels that the particular drug, he feels that the particular drug only produces state of well-being. So the person feels that he have to addicted, he want to addicted drug, means So it producing some euphoric like effect, the state of well-being without any pain, without any pressure, without tension. So he want to feel that state continuously, then he will addicted to the drugs. As I mentioned earlier, nicotine, alcohol, morphine, cocaine, some of the drugs like addicted drugs, when they enter into the brain, they stimulate, they motivate the addiction center in brain, that is nucleus accumbens, and increase the dopamine action. And dopamine is one of the important neurotransmitter in the CNS, produces euphoria. So euphoria nothing but highly excitable state, the state of well-being. Next, what is reinforcement? Ability of drug to produce effect that the user enjoys and which make him or her wish to take it again or induce drug seeking behavior. So he continuously taking the drug because his brain wanted to take drug continuously, because the brain habituated for the state of well-being, the state of euphoria. So drug seeking behavior, reinforcement, psychologically the brain forcing him to take the drug for habituated for that euphoria, highly excitable state, the pleasurable pleasant state without any pain, any tension, any fear. Drug abuse, the drug abuse also known as drug misuse. For example, sedative and hypnotics for the purpose of to produce sleep. The doctor prescribed maybe one or two pill daily, evening, daily, night. But if any person for the suicidal thoughts, if he took around 20 to 30 sleeping pills at a single time, they cause paralysis of the cerebellar center and leads to coma and death. That is drug misuse, drug abuse. Use of drug by self-medication in a manner and amount that is not approved by medical and social patterns. So generally one or two pills for the good sleep, but if you took 20 to 30 tablets at a time, 20 to 30 tablets at a time, what will happen? Definitely it may damage the cerebellar centers, paralysis of the cerebellar centers, and causes, it may lead to coma as well as death. It may lead to coma as well as death. That is drug abuse or misuse. Next, drug habituation. Yes, we will habituate to some drugs. Like for example, you can see clearly the tea, coffee, but these are not that much dangerous to our body. Let's see. Drug habituation, less intensive involvement with use of drug, so that its withdrawal produces only mild discomfort. The dependency is absent, dependence, addiction is absent. But for example, I habituated to tea or coffee, but suddenly if I stop take tea or coffee, mostly there is a not that much serious effects will be observed, very mild little bit side effects will be observed. Yes, like tea, coffee, tobacco. But in case of nicotine, it will be like partial. Definitely, we will get some effects if you suddenly stop taking tobacco, if you have in habituation. Drug withdrawal. So, what is drug withdrawal? Apart from drugs that are usually recognized as a producing dependence, apart from the drugs which are usually produces dependence, the patient depend on particular drug for his relief, and sudden interruption of therapy with certain other drugs also result in adverse consequence, mostly in the form of worsening of the clinical condition for which drug was being used. Example, acute adrenal insufficiency may be precipitated, may be developed by abrupt cessation of corticosteroids. So the person is taking corticosteroids continuously, but if suddenly stops corticosteroids, there is a chance of acute adrenal insufficiency. So insufficiency, decreased amount of production of corticosteroids. Okay, so drug withdrawal. So don't suddenly withdraw any drug. You have to withdraw slowly. If suddenly withdraw any drug from treatment and suddenly stopping taking of any drug, that may develop some withdrawal symptoms like anxiety, like nervousness, like sweating, like other body related problems. Other body related problems. Next. Yes, further continuation. Teratogenicity. So teratogenicity is also comes under the category of adverse drug effect. The ability of any drug to damage the fetus in pregnant women. Refer to the capacity of a drug to causes fetal abnormalities when administered to pregnant mother. Pregnant mother. Yes, you can see the images here clearly. So you can see the images clearly. They are with damaged hands as well as legs. I hope, do you know thalidomide tragedy? Do you know thalidomide tragedy? So what is thalidomide? In 1950s, especially in the United Kingdom, that is British countries. So there is a thalidomide is prescribed for the morning sickness syndrome in the pregnant mothers. So what is that morning sickness syndrome in the pregnant mothers? Generally in pregnant women's, there is a morning sickness like sedation, like dizziness, like drowsiness. That is because of progesterone, the pregnancy maintaining hormone progesterone, high level in the pregnant woman. So progesterone effect on CNS, it may cause sedation, drowsiness, as well as nausea and vomiting symptom. So to reduce that, morning sickness, the thalidomide is prescribed for the pregnant woman. It works well, but the pregnant woman who took this thalidomide, the babies with this half limbs, half hands as well as half legs, that is known as 𝘂𝙀𝙉𝙎. So the baby born with half hands, half legs, especially the pregnant mother who took this thalidomide, that is 𝘂𝙀𝙉𝙎. And here the list of the drugs that may damage the fetus, like thalidomide causes 𝘂𝙀𝙉𝙎, multiple defects of internal organs, anti-cancer drug especially methotrexate, cleft palate, that is maybe breakages in the tongue, hydrocephalus, accumulation of water in the brain, multiple defects, fetal death. Androgens may be virilization, the capacity of fertilization decreases, limb-esophageal cardiac defects. Progestins causes virilization of the female fetus. Virilization of the female fetus. Okay. Next, stilbestrol, vaginal carcinoma in the teenage female of offspring. Tetracycline, discolor and deformed teeth and retards bone growth. Warfarin, depressed nose, eyes as well as hand defects and growth retardation. Retardation means decreasing, not well developed. Phenytoin. So phenytoin-like drugs may causes hypoplasia of phalanges, hypoplastic phalanges, cleft lip or cleft palate, the breakage in the lips or tongue. Carbamazepine, neural tube defects, that is spinal cord defect, associated abnormalities. Valproic acid, spina bifida, so bulging of spinal cord outside of the vertebral column. Means you can see the Google images. So the baby backside will be, there is a bump like structure at the spinal cord region. Alcohol, low IQ baby, growth retardation, fetal alcohol syndrome, accumulation of alcohol in fetus. ACE inhibitors, hypoplasia of organs, that is decrease the growth of organs, growth retardation and fetal loss. Lithium, fetal goiter, cardiac and other abnormalities. Antithyroid drugs, Antithyroid drugs. The antithyroid drugs may develop fetal goiter and hypothyroidism. NSAIDs like indomethacin aspirin develop premature closure of ductus arteriosus. Next, drugs like vitamin A preparation, isotretinoin causes craniofacial heart CNS defects and also hydrocephalus. So damage to craniofacial bones and also hydrocephalus, accumulation of water in the brain. And next, these are the details of GDC Prime, which are starting from July 15, that is long-term batch for Gpat coaching, especially for the South India Pharma students by GDC classes. And here are the list of the faculties. So all are qualified Gpat NIPER faculty. Definitely you will get excellent knowledge and you can easily qualify in the competitive exams by the guidance of our list of faculties here. Okay. Yes, here some of the basic definitions like terminology. Carcinogenicity, ability of a drug molecule which can cause cancer. Mutagenicity, ability of a drug molecule which can cause genetic defects, mutations. Hepatotoxicity, drugs like isoniazid, a anti-tubercular drug, rifampin, anti-tubercular drug, pyrazamide, anti-tubercular drug, halothane, a general anesthetic. All these drugs may cause damage to liver cells, hepatotoxicity. Nephrotoxicity, aminoglycoside, a antibiotic against bacteria. Amphotericin B, a antifungal drug. Cisplatin, a anti-cancer drug. These drugs generally causes nephrotoxicity, damage to kidney nephron. Ototoxicity, drugs like aminoglycosides, loop diuretics may develop damage to ear, ototoxicity. Ocular toxicity, drugs like ethambutol, chloroquine, glucocorticoids develop damage to eye. And photosensitive reactions like demiclocycline, doxycycline, or the tetracycline generally develop photosensitive reactions, a type of allergic reactions when exposed to sun. Next, iatrogenic disease. So, what are iatrogenic disease? So, these are the also known as drug-induced disease or physician-induced disease. The meaning of iatros is a Greek word means physician, so-called physician-induced disease. In the Greek, iatros means the meaning physician, and this iatrogenic disease or drug-induced disease also known as physician-induced disease. So, iatrogenic disease result of diagnostic and therapeutic procedures. Result of diagnostic and therapeutic procedures undertaken on a patient with a multitude of drugs prescribed to single patient. So, prescription of multiple drugs to the single patient. The adverse drug reactions are bound to occur. The physician should take suitable steps to detect and manage them. So, iatrogenic disease or drug-induced disease or physician-induced disease. This is because of a wrong prescription by the physician or giving multiple drugs to the same person. So, on this, the physician should have knowledge and he should know the thing which drug should give to the particular patient. So, examples like salicylates corticosteroids should not given in the peptic ulcer. Phenothiazines may cause Parkinsonism, so don't take in or don't prescribe in the Parkinsonism patient. Isoniazid develop hepatitis, hepatotoxicity, and hydrolyzin chemically a phthalate derivative may develop lupus erythematosus disease. Lupus erythematosus disease. Yes, here these are the list of the antidotes and following drugs. So first alkaline. So for basic, the drug is alkaline like sodium bicarbonate, dilute acetic acid. Dilute acetic acid as an antidote for drug alkali drugs. And drug is atropine, a non-selective muscarinic receptor blocker. And the poisoning of atropine used by controlled by physostigmine. Physostigmine is a natural alkaloid from Physostigma venenosum, belong to the family Leguminosae or Fabaceae. This physostigmine chemically comes under indole alkaloid. So biosynthesis from the tryptophan amino acid. So like this, for atropine, for physostigmine, you can study medicinal chemistry, you can study pharmacology, you can study pharmacognosy also. So like this, around 30 plus drugs in the pharmacognosy, where you can study pharmacology, pharmacognosy, medicinal chemistry in the combination. So like this way of study, increase your focusness, increase your alertness, and you can remember the many things at single page. So atropine, pharmacognosy, pharmacology, medicinal chemistry. So like this study, improve your capacity to remember the things, and from these three subjects only around 40% of questions appearing in the Gpat exam. So poisoning of benzodiazepine or overdose of benzodiazepine by flumazenil. The drawback of flumazenil, high first pass metabolism through oral. Carbamates. Carbamates like physostigmine, neostigmine. The carbamates poisoning treated by using atropine. Calcium channel blocker poisoning by using calcium chloride. cyanide poisoning by using antidote, sodium nitrate or sodium thiosulfate. Digoxin poisoning controlled by digoxin immune fab nothing but bind. Heparin poison controlled by protamine sulfate available from the fish sperm. Protamine sulfate from the fish sperm. And insulin overdose controlled by glucagon. And overdose of iron compounds by using desferrioxamine. And lead poisoning by using dimercaptosuccinic acid or ETTA. Morphine overdose or morphine poisoning by using antidote or antagonist naloxone. Methanol overdose or poisoning treatment by using ethanol as well as fomepizole. Ethanol as well as a fomepizole. So continuation. So methanol poisoning by using antidote fomepizole ethyl alcohol. Fomepizole inhibits alcohol dehydrogenase enzyme and disulfiram inhibits aldehyde dehydrogenase enzyme. Organophosphate poisoning antidote atropine. Paracetamol poisoning antidote N-acetylcysteine as well as L-methionine. And warfarin overdose can be antagonized by using vitamin K. Vitamin K is a natural anticoagulant. So these are the list of antidotes. Yes, this is a good news for you. The fees of the upcoming Gpat coaching. So the good news is the fees is not 12,000 or 13,000 and it is only 10,200. So with all this you can get all these benefits like 500 plus daily live classes and 500 plus daily practice paper, 500 plus video lectures already in our app GDC. So GDC class app, so download from the Google Play Store, and 35 plus previous year papers and also ebooks available in our app. So further details you can contact under the GDC Prime Batch for South India pharmacy students starting from the July 15. From June 2nd, June 22nd onwards, daily at 9 p.m. in the YouTube channel of GDC English classes, any subject of Gpat syllabus are uploading like free live classes for you people, like demo classes. So you can watch watch the demos in GDC English classes YouTube channel. It may be from pharmacology, pharmacognosy, any subject from June 22nd to July 7th, daily at 9 p.m. The video will be uploaded. So pharmacology, myself and other subjects, other colleagues are there. So you can watch there and you can see how our potentiality is there, how we are teaching. So before you joining July 15 classes. So these are classes like demo classes to understand what is GDC English classes, how the classes are there, how the faculty are teaching, and you will get all the things. Okay, so thank you. We will continue with the next session. So subscribe to GDC English classes YouTube channel.